Thank you so much for having me today. My name is Dr. David Lazar. I'm a retina specialist in West LA. I'm a ophthalmologist, so I did 4 years of ophthalmology training, and then I subspecialized in doing 2 years of medical and surgical disease of the retina. Part of my practice is dealing with lupus patients, both the autoimmune, the direct effects of lupus, and also Plaquenil, a very common medication used to help manage the symptoms of lupus, properly screening patients and following them. I have about 23 questions here that were submitted, so I thought we'd just jump right in and start answering some of those questions.
Perfect. Let's do it.
Great. So I see a bunch of them are related to Plaquenil, which is that medicine that I mentioned earlier. We have questions like, what is my recommendation for schedule of Plaquenil eye screening? Are Plaquenil side effects reversible? How does Plaquenil affect the eyes, et cetera, et cetera? So I'm going to just kind of combine those all into one little bit and address all those questions. So Plaquenil is an exceptionally safe drug. Exceptionally. It's been on the market for decades. We know pretty much all there is to know about it. The only downside with Plaquenil is that if you're on it for a long period of time, and by long I mean over 5 years, there's a chance for permanent, irreversible damage to the back part of the eye. So we take it very, very seriously as eye surgeons because our job, what we do all day is try to prevent vision loss. And Plaquenil is very, very safe. But again, if you're on it for more than 5 years, the medication accumulates within the body and can directly cause toxic permanent side effects. It really does not happen in 2025, this toxicity that I'm talking about, as long as you're being followed by an appropriate physician who knows how to properly screen for changes. So I mentioned that really it's short of issues like having kidney disease or any other kind of retinal diseases, it's almost impossible to have Plaquenil-related eye issues before year 5 of the medication because it takes that long to accumulate in your body to cause the toxic side effect. So in terms of the question regarding how often do I recommend screening, the American Academy of Ophthalmology recommends yearly screening. Now that is yearly even before the 5-year mark. So if you're starting Plaquenil, you should get an eye exam the day, or the month you start, and that's year 1, and then every subsequent year. And the reason to do it, which is do it meaning be seen yearly prior to that 5-year mark, is that you have that way you get, first of all, you get used to being seen every year. You get used to the idea of every year that you're on Plaquenil, you should get seen. And as well as the fact that then you can accumulate some background images. So I use those images from the early years to compare the subsequent years to help monitor for any changes in the retina that I could attribute to Plaquenil. Are the Plaquenil side effects reversible? No, they're not. And that's why we take it so seriously. God forbid there are signs of retina-related damage from Plaquenil. The treatment is to stop the medication immediately. And using the sophisticated retinal imaging that we have, we're able to detect any sign of toxicity preclinical before the patient notices it. And that's so key to this discussion, because if you notice a change in vision that is related to Plaquenil, there's no reversing that. So the whole name of the game is to catch any sign of damage before the patient even notices it. And again, that's very easy to do, assuming you have the proper retinal imaging cameras and know what you're looking for. So let's see, is there anything else about Plaquenil here? Give me 1 second. So I said, how often should the screenings be done, which is yearly. But again, here's a question that it's specifically on this 5-year thing. My rheumatologist won't approve a visit to an ophthalmologist until my 5th year on Plaquenil. Is that normal? that is, I don't want to say is that normal. I would say that's not against that is against the recommendations of the American Academy of Ophthalmology. If I were on Plaquenil or a family member was on Plaquenil, I would recommend yearly follow-ups. Um, I don't know why you would need a rheumatologist approval for that. Just call an ophthalmologist, call a retina specialist, and get seen every year. That would be my recommendation. Again, that's purely based off the American Academy of Ophthalmology. So that's kind of my bit about Plaquenil. If there's any other questions, maybe we can get back to that at towards the end. Still on medications and lupus, I have a question here. Do medications like steroids increase my risk for cataracts or glaucoma? So steroid medications are fabulous medications. They are really good at treating and managing autoimmune diseases. However, the two issues that come with steroid use, whether that's oral steroid, topical steroid, steroids injected into the eye itself, the two issues that I worry about and that I see are glaucoma, which is a side effect, which is a high pressure within the eyeball. So people get confused. I'm not talking about high blood pressure, which actually is a side effect of systemic steroids, but I'm talking about if you think of your eyeball like a basketball, steroids can cause the basketball to be overinflated. That high pressure puts damage, it can eventually damage the nerves in the back of the eye, which we call glaucoma. So anyone who's on steroid medication, again, any form, oral, topical, etc., needs to have their eye pressure checked periodically to make sure that that's not happening, and if it is happening, be treated appropriately. And then the second issue that we worry about with steroid medication is cataract formation. So cataracts are age-related changes of the lens in the eye. I like to say, if you think of your eye like a camera, there's a lens in a camera, there's film in a camera. Cataracts is age-related clouding of the lens in the eye. And so that can easily be treated with cataract surgery, right? Where you take the old lens out, you put a new lens in. Um, Cataracts form from a lot of different conditions. Diabetes can accelerate cataract growth. Age is the biggest thing, and steroids. So if you're on steroids for a long period of time, it will cause the cataract to form faster than had you not been on steroids. Now, if you've already had cataract surgery and you have a lens implant in place, then we don't have to worry about cataract formation because it doesn't affect the lens implant, only the lens that you're born with. So steroid medication, fabulous, used all the time with with lupus eye disease, but just be careful of the side effects. And then there's a lot of questions here about Sjögren's and other ways that lupus can affect the eye. I'll just touch on this without getting into too much specific with just the general understanding that if you have lupus, that means you have an autoimmune condition. And you got to think about it like where there's smoke, there's fire. If you have one autoimmune disease, it predisposes you. It means that you are prone to other autoimmune diseases. Just it means that your immune system is not, fully regulated, and you're more likely to have other issues like Sjögren's syndrome. Sjögren's being disease that can cause severe drying of the eye. So just understand that if you have lupus and you have dryness of the eye can feel like sand or grittiness in the eye, a blurry vision. That could be a direct effect of the lupus. That could be a separate autoimmune condition called Sjögren's, or it could just be, unrelated dryness of the eye that can happen, living in California. The treatment for this kind of drying of the eye can vary depending on the severity. It could be as benign as just using lubricating eye drops, or it could, steroid eye drops work very well with autoimmune related dryness of the eyes. So, and again, that's probably more on the heavy hitter side of the treatment, with lubricating drops being on the other side. So it's important to be diagnosed properly and then treated appropriately for those drying of the eyes. Um, bu- 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 How often should people with lupus schedule an eye exam? You know, my my golden answer for these types of questions is yearly. Everyone should go get a thorough eye exam yearly, as long as there's no symptom change. What I mean by symptoms change is blurring of the vision. If you have blurring of the vision, if your eye is red, if you have pain in the eye, these are all ways that lupus can present in the eye. Again, that's blurring of the vision, pain, or redness of the eye. So if you have any of those symptoms, don't wait for your yearly eye exam. Call and get seen. And most ophthalmologists, if you call and say you're having kind of acute issues, should try to expedite you getting in. Yearly, you can't really go wrong with yearly exams. With yearly exams, you'll really catch a lot of things that before they kind of come to a head. Let's see, what else do we have here? Plaquenil screening. Should I be okay? This is back to Plaquenil. Should I be worried about continued Plaquenil use? This person's been on for 10 years. I get conflicting answers on this, and I would love an ophthalmologist's opinion. I tell patients this all the time. I have a patient currently in my practice who's been on Plaquenil for 38 years continuously, and for lupus, and she has no problems, no retinal problems whatsoever. I see her every 6 months instead of every year, only because she's been on the medication so long. But she's a perfect example of someone who can be on it for the medication for 38 years and no problems. As long as you're being followed appropriately and you're getting the appropriate screening tests, that I have no problem with anyone, even a family member or myself, being on Plaquenil for 10 years or more. The trick is just making sure you're being screened appropriately with the proper imaging and the proper interval. Just last thing on this, and then I swear I won't talk about Plaquenil anymore. The American Academy of Ophthalmology guidelines for what is appropriate Plaquenil screening changed in 2016. So if you just, if you are working with someone, if your eye care professional is, not keeping up to date as much, it's easy to miss these new recommendations, and they changed substantially for the 2016 recommendations from previous years. So again, I'm sorry, I could just talk about that all day, so I'll stop.
No,
Are
it's very
conditions
helpful.
like, excuse me?
That was very helpful.
Oh, okay. Here's another question. Are conditions like scleritis and uveitis related to lupus? Again, that touches on what I said previously, which is any itis, any inflammation can be associated with lupus. Any autoimmune disease is dysregulation of the immune system, and the immune system can go anywhere in the body, including the eye. So scleritis and uveitis is just a general term for inflammation of the wall of the eye. And yes, it is common with lupus because it's an autoimmune disease treated usually with steroids. Then there's some specific questions that I won't touch on. Best treatments for Sjögren's, we touched on that briefly. I'll say one thing about dry eye disease. Assuming that we're treating dry eye disease with artificial tears, I'm not talking about steroids for this example. The biggest thing I get is that people do not use their artificial tears enough. People get really caught up on what is the best brand, what is the best type of artificial tear, when in reality, no one is using it properly. They're using it 1 time a day, 2 times a day. But if you need lubricating eye drops, you got to use it, you can't overuse it basically. And I'm not talking about Visine, I'm not talking about things with medicine in it. I'm just talking about lubricating eye drops, artificial tears. You cannot overuse them, and you should be using them anywhere from 5 to 10 times a day if you want to really hydrate the eye. So again, the biggest thing I see with treating dry eyes, whether it's from lupus or otherwise, is patients will come in and they'll say, what's the best, I'm using this drop for this artificial tear and it's not really helping. What's the best drop? I don't care the price. And I say, well, how many times are you using it? And they'll say something like once or twice. So that's just not going to help. You got to use it very, very aggressively. I actually think, I kind of brought all the questions in here. Are there any live questions?
Yeah, we have a few if you have a moment for us, Dr.
Sure,
Lazar.
sure.
So one person had asked if I got cataracts and I need surgery, is it safe for someone on immune suppressants?
Yes, I get that question a lot. Anytime you do cataract surgery or any type of surgery, you're taking an instrument that's outside of the body and you're introducing it into the body. Um, there's always a risk for infection, no matter what surgical intervention, cataract surgery or otherwise. The risk is exceptionally low. It's, depending on what study you're reading, somewhere in the order of 1 in 10,000. It's exceptionally rare with cataract surgery. Um, if you are concerned and you're immune suppressed, um, cataract surgery is essentially elective. So either wait until you're not on the immunosuppressive medication, um, or if that's not possible, I still think it's exceptionally safe. It is a conversation to have with your cataract surgeon. I would bring it to his or her attention, but it is, in my opinion, not a contraindication. I do retina surgery routinely on patients who are immunosuppressed, whether for various reasons, and there are no issues.
Okay. And then if you are pre-diabetic or diabetic preparing for cataract surgery, is there anything that you need to do or consider differently?
No, no. Again, it all depends on the level of diabetes. If your some cataract surgeons with their diabetic patients refer them to retina specialists to rule out or see if there's any diabetic retinopathy. Diabetes, the way it affects the eye is actually the back of the eye, the retina. So it's not uncommon that I get referrals from cataract surgeons saying, "Hey, I'm going to do cataract surgery on this person. Do you mind taking a look in the back and making sure we don't need to do anything up front before the surgery to kind of optimize the eye?" So that's one thing that can be considered. But no, for the vast majority of diabetics, again, as long as the cataract surgeon is aware of the diabetes and the blood sugar is under reasonable control, there's nothing that needs to be done up front.
Okay, great. And then I'm not sure if you can comment on this one. It's a little specific, but they said I'm on Plaquenil, steroids, and a biologic. Did these combined meds increase my risk for eye issues?
I think that's a little, yeah, specific. I probably shouldn't dive into that too much.
Thank you so much for your time, Dr. Lazar. We really appreciate it. For anybody who's interested in learning more about Dr. Lazar's practice, we're going to put a link in the comments in the caption, so we can route you to him if you have any, specific questions or are interested in becoming a patient. And if you have any other questions about lupus in the eyes, you can send them to us either via DM on social or at info@lupusla.org, and we can help you out.
Thank you so much for having me. I really appreciate it.